Hi, my name is Anthony O'Connor. I'm a licensed acupuncturist and herbalist, and today we're going to ask the question, does acupuncture hurt? No. The simple fact of the matter is, if acupuncture hurt, I wouldn't be in business. Might be a controversial thing to say, but I don't think a lot of people are too crazy about needles. Now, the great thing about acupuncture is the needles we use are very, very different from a hypodermic. Hypodermic needles are obviously hollow. They have to carry whatever it is being injected, or they have to be able to draw blood. And what that means is when you actually look at a hypodermic under a microscope, it doesn't actually come to a point. It's actually kind of shaped like a blade. So hypodermic needles actually slice through the skin. Acupuncture needles, though, they do come to a tapered point. There's nothing being injected. The acupuncture needles are solid. And what that means is they pass through the skin much more easily and painlessly. They're also incredibly thin. Acupuncture needles are about as thin as a human hair or a fiber optic cable. They're also very, very flexible, which people may not realize. It actually takes a special technique to be able to get an acupuncture needle through the skin. If you just jab it, it'll just bend. The other good thing about this is you can move slightly while the needles are in. Some people think they're rigid and you're going to be pinned like a butterfly to the bed. I personally wouldn't recommend doing a full calisthenics routine or anything, but you can definitely move around a little bit with the needles in. You're not going to do any kind of damage. So there are two stages to inserting an acupuncture needle. Insertion and then finding the Deqi. When inserting the needle, the goal should be to get it through the skin as quickly as possible. The skin is where most of your nerve endings are. Those of us with tattoos can attest to that. So the quicker you can get the needle through the skin, the less pain or discomfort the patient is going to feel. In China, needles are commonly free-handed, is what we call it. That means you just use your fingers and you use a special technique, and this pushes the needles through the skin. As I pointed out before, the needles are very flexible, so you need to learn the proper technique to do this, and that technique doesn't always come to everyone so easily. I remember being sat at my kitchen table in China for hours on end, just trying and failing to jab an acupuncture needle through my own arm. I really hope my patients appreciate what I've been through for them. Thankfully, my needling technique is a lot better now. And the doubly funny thing is, in the West, most practitioners will actually use what's called a guide tube. You place the needle in the tube, you tap the top of it, and this fires the needle through the skin very, very, very quickly. Most people consider this to be the most comfortable form of needling technique. The next stage then is Deqi, which is the manipulation of the needle in order to find a particular sensation. So in Chinese, there's lots of different words for these sensations, but in the West, we don't really have many that describe them so well. Sometimes it's called an ache or a distension, but even though it is a sensation, all of these words have very positive associations in Chinese. It's like the kind of ache you get after a strong massage, rather than the kind of pain that would be associated with an injury. I often use what's called even needling technique. So what that means is I insert the needle until I find the Deqi, but I don't do a whole lot of manipulation with it. But if somebody needs a stronger treatment, or if their issue is very, very acute, like severe back pain, we can turn up the volume by manipulating Deqi. A specific example of this would be, let's say, sciatica running down the outside of the leg. So this is considered to be the Shaoyang meridian in Chinese medicine, so I'll often needle a point called YangLingQuan, and I will needle it very strongly, so you get a kind of a jolt going along the outside of the knee. This is the area affected by the sciatica, and by manipulating the needle really strongly, we can interfere with the nerve signal and we can reduce the pain. Now, we don't think of it in terms of interrupting nerve signals, we think of it in terms of coursing qi through the Shaoyang meridian, but it amounts to the same thing. We can also turn down the volume of Deqi for very sensitive patients. So we can do this by using smaller needles, no manipulation, distracting techniques before the needle is inserted. Sometimes I'll even use anesthetic points as my first points. So for example, I'll put in ShenTing, which is a point that relieves pain through the whole body and relaxes the mind. So we'll put this in first so that the sensation from the rest of the needles is even less. So the short answer is that while acupuncture doesn't hurt, it is associated with certain sensations, but these sensations are under the control of the practitioner. The vast majority of my patients have a very pleasant experience and they're out like a light as soon as the needles go in. And for those that need the stronger treatments with the more intense Deqi, usually they're in so much discomfort coming in that they don't care what I do as long as I can relieve their pain. Alright everyone, that's it for this week. Thank you very much for watching. If you have any questions, please leave them down in the comments. Thanks again.